Hi everyone, this is Dr. Paul Martin with Brilliant Life Chiropractic, and today I was going to talk about a little bit about prescription drugs. I came across an article that I thought was really interesting, and it had to do with the sort of the prevalence of prescription drugs and how often people are taking them. Now, I've mentioned before on this channel how I feel that drugs in general, I mean there are exceptions, but in general, prescription drugs do a great job of covering up symptoms rather than actually managing diseases and helping provide a cure. Now, in some cases, that's different, obviously. And some people do need medication on a regular basis, on a long-term basis, to manage a chronic condition for which we don't know what's causing it and have no particular cure for. But in general, even that is managing the symptom. And sometimes there are lifestyle things that can be done to help. But anyway, I thought some of these numbers were kind of interesting. Now, chiropractic, we know, works with the natural systems of the body to help it stay healthy and in top performance. And if you've been listening at all to my channel, you know that not all symptoms indicate disease per se. They can indicate an imbalance, but then they are also part of the way that the body is helping to restore natural balance. Like, for example, fever, when it shows up, is a way of killing off excess virus or bacteria and helping your immune system fight it better. And by killing that fever with a medication, then you're hampering the body's ability to heal itself. I also think that regular anti-inflammatory medication can leave you more open to infection, and will also, if you're dealing with like joint issues and pain, like you sprain something, it can interfere with the body's ability to heal that, and then also the body wants to keep creating this inflammation. So now you have a long-term injury and long-term inflammatory condition. The article takes on the assumption that medications are a vital component of healthcare for almost everybody. But I mean, some of these numbers. If you look at the averages across all adults, the average number of prescriptions filled per year is 9. That's like almost one a month. Which means you're more often on a drug than not. Between the ages of 18 and 34, it's 3 per year, and 53% of people are using a medication in a year. That's half. The numbers, of course, go up as people get older. 75% are taking a medication from ages 50 to 64, 13 meds filled every year. So 75% using it, average of 13 meds. That's more than one a month, and probably more than that, depending on how they came up with that. So if 75% are making the averages across the board 13, that means that they're taking more than that. Now, how many of these medications are being taken for things that could be dealt with through lifestyle modification? Like I said, for some, prescription meds are a necessary component of health, but I think that's probably the exception. Speaking as someone who does things to take care of his own health. I mean, I eat very well, I exercise, I get regular chiropractic care. I take no meds, and in an average year I take no meds, and I'm 41 years old. And according to this, that is in the minority. And I plan on continuing that. Like for some conditions, like diabetes is a big one. Diabetes is often treated with drugs. And it's considered to be, if I can just find it in here, yeah, it's probably the most expensive one based on what they're looking at. Diabetes, heart disease, hypertension, arthritis, and cancer. It trumps cancer. Diabetes medications account for over $1,000 a year. Easy. And that's average, so I think for some it's a lot more. Now, diabetes is almost entirely a disease that can be managed through diet and lifestyle, at least type 2 diabetes, right? Adult onset diabetes. There are types of diabetes that you have to manage with medication, or there's just no other way. And we're finding diabetes working more and more, looking more and more. It's adult onset type diabetes, and yet it's affecting children more and more, and it's because of our lifestyle choices. And if you go to like diabetes lectures, symposiums, diet and lifestyle is hardly ever addressed. They go right to medical management. And by medical, I mean medicine. And that's a problem. So I think my point with all of this is really to highlight this, and to encourage people not to be so quick to go to a medication. Now, this video in no way is a diagnosis or treatment. I'm not trying to diagnose your condition. I'm not trying to tell you that you should go off your drugs. You have to speak to a doctor about that. And every single medication that you take will have side effects. Those side effects are not always pleasant. They are effects of the drug, and they can interact with any other medication that you're taking. And anytime you've got medications that haven't necessarily been studied together, it's basically a new thing. And anytime you add a new med, now you've got a three-way, one with that one with that one with that one, and it gets very confusing. Add a fourth med, which a lot of people are doing. They're taking one for heart disease, high blood pressure, and diabetes all on top of maybe they have allergies at the same time, so now they're taking another med. Those all have interaction possibilities. And normal use of meds can kill. So I just encourage you, don't be very quick to go on meds. If you need them, great, but please speak with your doctors about it. And maybe look for another way. You too can live a brilliant life, and I don't believe that for most people that includes a lot of prescription meds. I'm Dr. Paul Martin with Brilliant Life Chiropractic. You deserve a brilliant life. Let it shine.